Vijay, you can start.
Can you put it on full screen?
Yeah. Okay. Ram sir.
Yeah, I'm coming.
Your
Yeah,
camera
now
is
now
on.
it is good. Now it is good.
Okay. So sorry for a technical glitch. Good evening, everyone. I hope most of you been attending webinars. Sorry, just a minute. I hope most of you been attending webinars since last couple of days. So far, Manojagrithi team finished webinars, several webinars. On the day one, we discussed about overview of webinar series, where our team talked about house of health and general mental health issues. On day two, our team spoke about generalized anxiety disorder. Generalized anxiety disorder is a mental health disorder that produces a fear, worry, and feeling of being overwhelmed. So on day three, our team discussed about postpartum depression and premenstrual dysphoric disorder. On the day four, our team discussed about several childhood disorders. If one of you missed any of these webinars, you can still access in YouTube or through our webinar WhatsApp group. There are links provided there. So today, myself, Ram Chandra Reddy Shapuram, and my colleague Vijeta Asthana will be presenting all phobias, understanding and overcoming all types of phobias. So before we get into our topic, we would like to thank Geetha ma'am and Vijayalakshmi ma'am for providing this opportunity. Geetha ma'am is the founder of Manojagrithi and Sudisha Counseling Center. Manojagrithi, Manojagrithi is a non-profit organization dedicated to promoting mental health awareness and preventing mental health issues, aiming to build a healthier, value-driven society. Founded on the belief that harmony between mind, heart, and purpose makes anything possible, that the team includes several psychiatrists, psychologists, counselors, special educators, and social workers, supported by NGOs and professional networks. Sudisha Counseling Center is unit of Manojagrithi, is a registered NGO since 2012, working towards creation of mental health awareness. Geetha ma'am works with the government bodies, NGOs, and educational institutions, and global firms like Optum and EAP services, impacting over 2.5 million students. Vijayalakshmi ma'am is a clinical psychologist and also she is our Sahaya Diploma Course Coordinator. Now, let's start our session with a conscious breathing and grounding technique. Over to Vijeta.
Thank you, sir. So today, let's take a moment to reconnect with ourselves through simple yet powerful mindfulness techniques. Pause, breathe, reset is about stepping out of the autopilot and into the present moment. So before we begin, we'd like you to explore conscious and tactile breathing to calm the nervous system, followed by a 5-4-3-2-1 grounding technique to anchor us in the here and now. These practices are quick, accessible tools that help you manage stress, improve focus, and bring clarity to your day. So let us start with a relaxation technique called the conscious breathing to relax our body and mind. I would request all of you to sit comfortably, remove any tight-fitting accessories like spectacles, wristwatches, etc. Relax your body with your back and neck in a straight line. Breathe normally. Place your hands on your knees, feet firmly on the ground, uncrossed, and continue to breathe normally. If you're comfortable closing your eyes, please do so, or just lower your gaze to the floor. Now, breathe in and feel your chest and stomach rise. When you breathe out, notice your stomach relax and return to the normal position. We'll do 2 more rounds of this. Breathe in and feel your chest and stomach rise. Breathe out. Notice your stomach return to the normal position. One last time. Breathe in. And let your stomach rise and your chest rise. And breathe out. And let your stomach come back to the normal position. Continue to keep your eyes closed. And now we move on to the next technique, which is called the mindful breathing technique, tactile breathing. With your eyes closed, hold one of your hand up and spread all the 5 fingers like a star. Now, place the finger of your other hand at the bottom of the thumb. We need to breathe and trace the outline of each finger. So as we go up, we will trace and take a slow breath in. And as we trace down, we will slowly breathe out. So let us start at the thumb. As you trace up, take a slow breath in. And as you trace down, slowly breathe out. Keep going. Now, trace up your index finger. Take a slow breath in and trace down while you breathe out. Inhale when we're going up, exhale when we're going down. Focus on the touch and your breath. Feel your finger moving around your hand. Stay on the breath slowly and steadily. And if your mind wanders, gently bring it back to the present. As we trace up the next middle finger, take a slow breath in and trace down. Slowly breathe out. Feel your finger moving along your hand and let your breath stay slow and steady. As we trace up the ring finger, take a slow breath in, and as we trace down, slowly breathe out. Focus on the touch and your breath. Feel your fingers moving along your hand. Breathe in slowly and steadily. Next, we trace down to trace up the ring finger. Take a slow breath in. And as we trace down, slowly breathe out. Continue to focus on your breath. When you reach the bottom of the ring finger, slowly move your hand over to the last finger, which is the little or the pinky finger. Once we reach the bottom of the pinky finger, finish and pause. Continue to keep your eyes closed. Now, notice the sensations in your body. How does your body feel? Now let's move to the grounding technique. Continue to keep your eyes closed and listen carefully and notice any 5 things that you can hear around you. It could be the sound of the clock ticking, the fan, any birds or traffic from the distance, any footsteps around you or rustling of the clothes, or any other background noises which you hadn't heard before. Bring your awareness to the textures and the physical sensations around you. While you continue to keep your eyes closed, extend your hand to touch any 4 things that you can reach out to comfortably. This could be the fabric of your clothes, the surface beneath your hands or feet, the cool breeze flowing around on your skin, or any object like a pen or the chair that you're sitting on or a table in front of you. Now, take a deep breath and notice any scents around you, any 3 things that you can smell. A food or a drink that is lying nearby, the natural odor of the smell of the room, or even the scent of your perfume or lotion or just your clothing. If you don't notice anything for the smell, just try remembering the favorite scent or rain or the smell of mint or cinnamon. Now, please join your palms together. Rub them to generate heat. Once they feel warm enough, place them on your eyes. Continue to keep your eyes closed and just feel the warmth of your palms on your eyes. With your eyes closed, please place your palms back on your knees. And when you feel comfortable, slowly open your eyes. Now, look around slowly and stop your gaze on 2 things that you can see. Observe them non-judgmentally. Observe their color, shape, or the pattern, or anything in those objects that you hadn't noticed before. Now, bring your attention to the sense of taste. I hope everybody has brought an amla candy or anything else. So please take that and gently place it on your tongue. Notice its texture and the first hint of flavor that the candy gives you. Slowly swirl that in your mouth. Now, take the first small bite and pay attention to the taste as it spreads. Does it taste sour or does it taste sweet? Now feel how the flavor lingers and awakens your senses. I hope this activity has brought you back to the present and now. Now let's move over to the topic of the day, which is all about phobias. Now, I would like to start with a quick question to all of you. You can share your answers in the chat box. I'm sure that each one of us has felt scared of something at least once in our lifetime. It could be the fear of speaking in public, fear of heights, spiders, or any crawly insects that we find around in our house. Now, I would like you to think of what does that do to you? Does it help you sense danger? Or does it simply give you a creepy feeling? Or an instant emotion of staying out of danger? Now, here's something that you need to think about. Is it just fear, or it could possibly be a phobia? While fear is a natural response to danger, a phobia is much more intense, irrational, and can interfere with our daily lives. So today, we're going to explore the difference between the two. However, I have a question for you all before this. Raise your hand if you're scared of something like spiders, heights, or speaking in public. Now, think about it. Do you just fear that? Or it could possibly be a phobia? And what do you think is the difference between a fear and a phobia? We'd like to see some answers in the chat box. Right? I do see some responses. Fear is an instant emotion of danger. Okay. There are people who have a creepy feeling about certain crawly animals. Okay. And Radha ji says we can overcome fear. Okay. Fear of dogs is for an instant. Okay, right? All right, great. Thank you so much for those. Now moving on, we'd like to understand what is your understanding of phobia, or how do you define a phobia? Again, please use the chat box. Panic when you face it. Fear can be rational. Fear is an instant danger. Okay. All right. What is your understanding of phobia? All right. We don't want it to happen, or we don't want to face it, right? Phobia is a prolonged time fear. All right. Great. It's a long line of panic fear. Okay. Strong fear or hatred. Perfect. All right. Extreme fear in specific conditions. Absolutely. Fear gives adrenaline rush, whereas phobia is avoidance to attempt. All right, great. So those were some good responses that we received. Now let us understand, in a layman's term, phobia is more than just being afraid, right? It's an intense, irrational feeling of a specific object or situation that can significantly impact our daily life, right? And according to WHO, phobia is defined as marked or persistent fear, often leading of unreasonable things, often leading to avoidance and enduring the situation with intense distress. So, okay. Now, DSM-5 highlights that fear is disproportionate to actual danger and lasts for months and causes real challenges in personal or social functioning. Today, we'll break down what phobias really are and how they affect those who experience it. Now, let us understand the difference between fear and phobia. So please use the chat box to share your responses about what do you feel is the difference between the two. All right. So here is a picture. Okay. Fear is fight or flight. In phobia, you freeze. Absolutely. Fear can be overcome, but phobia is persistent, right? Fear hinders our daily life. All right. Thank you for those responses. Now, when you look at this picture, the outermost circle talks about fear. When the fear becomes very intense and then it becomes persistent and starts interfering with your daily life, then that becomes phobia. So, like all of you rightly mentioned, phobia is intense and persistent and it hinders our daily life. However, the major differences between phobia and fear is fear is an emotion which is a temporary response to an object or event, and it is real danger. But phobia is an illness, and it's a long-term illness, which is an unnecessary condition where the person perceives threat even though there is no real danger. Fear will be gone with time. It just remains for a few minutes after the incident, but phobia needs a treatment. Now, let us also understand what are the main causes of phobias. Now, phobias develop with a combination of factors. Some of these factors are genetic predispositions that we inherit, some learned behaviors that we observe from others, and some traumatic or challenging experiences, especially those that we have seen during our childhood. Our thinking patterns, the environment that we live in, and the cultural expectations also shape how phobias form and persist in a person. Now, now that we've understood the causes, let us understand the symptoms of phobia. Phobias can affect us in many ways, showing up not just in our minds, but also in our bodies and our behaviors. Now, from physical symptoms like dizziness, a rapid heartbeat, to an emotional experience such as an intense fear and panic attack, the behavioral pattern like avoiding certain situations, phobias can impact deeply in our life. Understanding how these symptoms help us recognize phobias early and supports those who struggle with them is the most important thing. Now that we have understood a little bit about phobia and the difference between phobia and fears, we also need to understand what are the misconceptions that have been created because of confusion and stigma. So here it is essential to separate myths from facts and understanding the truth and supporting those that are affected by this. So today, let's explore some of the common myths and uncover the facts behind them to help build awareness and promote the accurate knowledge. So while we have the tiles coming up on the screen, I would like you to share your responses about this one being a fact or a myth. So here comes the first one. Phobias are just overreactions. What do you all think? Is it a fact or a myth? Fact. Okay, Shravantiji says fact. Okay. Few more say fact, some say myth. All right. It is, in fact, a myth. Phobias are not overreactions. They are real illnesses. Now, the next one. Most require intervention for improvement. So most of the phobias that we have require an intervention for the person's condition to improve. What do you think this is? A fact or a myth? Fact. All right. Most of them are saying fact. Absolutely, it is a fact. The next one. They go away on their own. Okay, it's a myth. Absolutely. Phobias are treatable with help. All right. Fact. Yes, a lot of you are saying fact. It is in fact a fact. Now, the next one. Only weak people have phobias. Strong ones don't get any phobias. Absolutely. That is a myth again. Next one. Phobias are recognized mental disorders. Is it a fact or a myth? Yes, it is a fact, like most of you have been mentioning in the chat. Thank you. Now, the next one. Phobias are silly fears. A myth? Yes. Anyone can develop one, a phobia, even a confident or a successful person. Is it a fact or a myth? Fact, like most of you are saying. Absolutely, this is a fact. It doesn't leave any person or doesn't skip certain individuals just because they're successful and confident people. And the last one, you can just face your fears and it'll go away. A myth. Yes, it is a myth, in fact. Well, I see that most of us have understood the difference between what a myth or what a fact is surrounding the phobias. So thank you for all those responses. And now, moving on. There's the data on the screen for you all to reflect upon. When we look at the data on mental health, especially conditions like phobias, it is important to remember that the numbers that we see often don't tell us the full story or a clear picture, especially when it comes to lower or middle income groups in India, because stigma and the diagnostic gaps that are there, many of the cases go unreported. So these are some key facts that we were able to identify from the sources mentioned below on the screen, while keeping in mind the challenges in capturing the true prevalence. So with that, I will hand this over to Ram sir to explain about the different types of phobias that we have.
Hey, there are three main types of phobias. We'll discuss more in detail. There are specific phobias. Agoraphobia, and social anxiety disorder. It's also called social phobia. So, social phobia was previously, as per ICD-10 and DSM-3, it is an older term, whereas social anxiety disorder is a new term we use as per DSM-5 and ICD-11. So now recently, it's we are calling as a general, basically widely accepted in current clinical setting as a social anxiety disorder. So it's less, social phobia is nowadays less commonly used. So what are specific phobias? Does anybody know about it? You can mention in the chat if you know any specific phobias.
They're saying claustrophobia.
Okay.
Specific things that cause extreme fear. Okay. Fear of loneliness.
Loneliness. Yes.
Right? Darkness.
Darkness.
All right. Lizards, traveling. Fear of injections, heights. Okay. Fear of dogs. Fear of water. All right. I think they know a
Yes.
lot of such things that are called specific phobias. You can move ahead,
Yes.
sir.
So the fear of a specific object or a situation actually usually begins in a childhood. So these social specific phobias can be grouped into 5 subtypes. They are like animal type, natural environment, blood injection related, situational, and other related phobias. So I think most of the people told in the chat like their fear of animals like dogs, spiders in the previous discussion, and some insects, right? Those are all animal type of phobias. And natural environment phobias, I think few people mentioned about fear of heights, okay? And thunder and lightning, that is called astrophobia. And some people scared of ocean or deep water. And someone mentioned about darkness, that is nyctophobia. So these are related to environmental phobias. So there are some type, they are like situational type, like fears of specific situations. It may limit lifestyle and travel. And some common examples like flying or closed spaces. I think a lot of people are scared of elevators, getting onto elevators. So that is like elevator phobia. And I remember a lot of people like when they see a blood, they are like the fear of seeing a blood. That is like blood injection. And also some very saving and so like some people like when they see blood they like faint. So some people are afraid of needles. So and there are other type of phobias also, which brain and like but the the something which is prevalent. Fear being something that everybody connects with that. Without if you don't phone like that is like big especially the youth. So I'll know without the phone and fear of clusters of holes. So like if you see clusters of holes, you are fear of that. So it's trypophobia. So as for DSM-5 criteria, so what is a specific phobia? So we discussed about like 5 different type of phobias. That as for this DSM-5, it's a marked fear or anxiety about a specific object or a situation. We discussed about it. The phobic object or situation almost always provokes immediate fear or anxiety. And the fear of anxiety is out of proportion to the actual danger. It lasts like more than 6 months or more. So the fear causes clinically significant distress or impairment. So not better explained by other mental disorders like OCD, PTSD kind of things.
Ram sir, are you there?
Geetha, you can continue.
Okay. All right. So while he was talking, I think there is some disconnect in the technical techniques for him. So moving on to the specific phobia facts. Now, specific phobias are moderately inheritable. Environmental factors actually play a bigger role in this development of specific phobias. Another important fact that we have to note is that between 7.9 to 15.7% in the world develop a specific phobia at least once in their lifetimes. And more prevalent in women, that is between 10.3 to 26.5%, And with men, it ranges between 5.5 to 9.9%. Now, of the specific phobia cases, if you look at it, the data says that approximately 29% is severe, about 30% is moderate, and about 48% is mild. Now, that was about specific phobias. Moving on. Like the title says, if social anxiety could speak. Now we see a metaphor on the screen that says living with social anxiety is like walking through a hall of distorted mirrors. Nothing looks right, but it all feels real. Every glance burns like a spotlight, and every word risks a fall. Now, this is something which people who are actually living with a social anxiety can imagine. They feel that everything is just off, and yet painfully real for them, making every glance and word feel like a risk. Or think of it as a faulty smoke detector in the brain, wherein a smoke detector is designed to protect you, but there is a constant alarm blaring in the brain which says there is danger, even though there is no real danger. This intense and exaggerated response distorts how you see yourself and others, while creating a constant feeling of being judged and on the edge. Today, we'll explore what social anxiety actually feels like from the inside and why understanding this actually matters. So, social anxiety disorder is more than just a person being shy. It's an intense fear of being judged or embarrassed in social situations or during a performance. This fear often leads to avoiding everyday activities like speaking up or even eating at a public place, which can significantly impact our relationship and careers. If it's left unaddressed, it can cause isolation and contribute to depression. Today, we'll take a little look at what this is like for everyone. Now, as per the DSM-5 criteria, social anxiety is marked fear or anxiety about one or more of the social situations in which the individual is exposed to possible scrutiny by others. The individual fears that they will act in a way that they will be negatively evaluated in. Social situations are avoided or endured with intense fear of anxiety. Social situations almost always provoke fear or anxiety for them. The fear is out of proportion to the actual threat. And this should have lasted for at least 6 months or more. That is when it can be diagnosed as a social anxiety disorder. This also causes significant distress and functional impairment. Also, it is important to understand that the symptoms should not have been better explained by another disorder or because of substance use or any other medical condition. Now, what causes social anxiety and disorder? Social anxiety doesn't happen without a reason. It is often a result of multiple factors. Genetics can make people more vulnerable, while life experiences like trauma or challenging environments around them play a very big role too. Cultural expectations and pressures can add another layer, shaping how we see ourselves and how we interact with others. Now, a little more in detail about the genetic predisposition. People inherit it as a natural sensitivity from their family genes. While the environmental influences are something that contribute to our growing up, and if a person has been living in an unsupportive environment, a traumatic experience, like we all understand, is something which is a very negative or an embarrassing situation which has happened in a crowd, which can trigger any long-lasting fears that can lead to social anxiety. And lastly, societal pressures and norms about how a person needs to behave can also heighten the anxiety in social settings. So that was all about social anxiety disorder. Now let's talk about the third one, which is called the agoraphobia. Now here, we'll start with a little case study that we have. There was a lady named Neha. She was a 38-year-old homemaker, from a semi-urban town. One day, she reported to the district hospital's psychiatry outpatient department with complaints of intense anxiety and fear when stepping outside her home alone. These symptoms began gradually since the last 8 to 10 months. Following a panic attack she experienced in a crowded local market one day. Since then, she has progressively avoided public places such as markets, temples, bus stops, and now she refuses to go out unless she is accompanied by her husband. Her avoidance behavior has significantly impacted her daily functioning. She no longer attends local women's gathering or even family events and feels increasingly isolated. Now, Neha is aware that her fear is excessive, but she finds it difficult to control, leading to emotional distress and dependency on her spouse. Now, what happened here when she visited the hospital? There was something called as a mental status examination that was conducted, where Neha appeared neat and appropriately dressed, but visibly anxious and fidgety. She was cooperative, yet slightly guarded, with limited eye contact. Her speech was spontaneous and coherent. She described her mood as being worried at all times, and her affect was anxious with a restricted range. Thought processes were logical and goal-oriented, with thought content centered on her fear of being alone in public and sometimes imagining something terrible happening to her. There were no perceptual disturbances. She was alert and oriented at all times, at every place, and with every person. Her insight was partial, and she acknowledged her fears but felt unable to manage them. And her judgment was intact in daily matters but impaired in anxiety-related situations. Then there was a clinical analysis conducted. She was provisionally diagnosed with agoraphobia, consistent with DSM-5 criteria and also with the ICD-11 criteria. A treatment plan was then formulated that included cognitive behavioral therapy with emphasis on gradual cognitive restructuring, along with psychoeducation about anxiety and avoidance. There were also a few relaxation techniques that were prescribed, such as deep breathing and a guided imagery that was introduced to her for the first time. And also a family counseling was done so that she had a supportive environment around her during these specific situations. Then also a medication was administered to her, a specifically low dose of SSRI, and was also considered to support therapy. Stigma initially delayed help seeking, and her family attributed the symptoms to an evil eye or emotional weakness. Many religious rituals were attempted before the medical consultation. However, with psychoeducation and support from her husband, Neha showed willingness to engage in therapy and thus began her recovery journey. Now, over to you, Ram sir,
Okay.
to take a detailed look about agoraphobia?
So based on the case study, what Vijayta discussed, probably you understood little bit about agoraphobia. So, as she mentioned about it, so agoraphobia actually is a fear of public transport. It could be public transport. It could be going to shopping centers, or sometimes going to open spaces, or sometimes going into the crowded places, being outside alone, or going anywhere alone. So these kind of situations where someone could be diagnosed as a agoraphobia. So, so basically, if you see this picture, you can understand like someone feeling about like, okay, I'm in the bus, I can't exit the bus. So sometimes they feel panicking. So basically, it's often agoraphobia often linked with the panic attacks. Can lead to severe life restriction. They're scared of going out. They're scared of going into like public by going in a public transportation. Now recently we see plane crashes and all. Some people started feeling okay getting into the planes also. Like sometimes they are feeling those kind of things, right? So going into the crowds. So they often develop a. It's normally start with first time panic attack, then it continues with the several situations. So as per DSM-5 criteria, same thing. Agoraphobia is basically marked fear of anxiety about two or more of the situations where it could be a public transportation, it could be a being in open spaces, which we discussed about it, and being in enclosed spaces like theaters, shops, and standing in line or being in a crowd, being outside of the home alone. Actually, the person fears these situations because escape might be difficult or help may not be available. The agoraphobic situations almost always provoke fear or anxiety. So these situations are actively avoided, require a companion, or ended with a great fear. So the fear is out of proportion. So if it normally lasts more than 6 months or more, so it causes clinically significant distress or impairment. As we discussed, it's not better explained by another condition like social anxiety, PTSD, and OCD. Sorry. So what causes agoraphobia? It's similar to other phobias. It's a genetic predisposition. It could be a trauma. It could be parental overprotectiveness. It could be adverse childhood experiences, or it could be a dependent and avoidant personality traits. So there are key differences. Like we learned about now specific phobia, social anxiety disorder, and agoraphobia. So there are quite key differences are there. How it triggers basically. So specific phobia, it's like normally by specific object or situation creates it. So social anxiety disorder or social phobia, it's like social evaluation, judgment kind of things. Agoraphobia, it's as we already discussed, environments where escape might be hard. They might think, oh, I can't exit from this location. So, so specific phobia, avoidance, yes. Social anxiety order also, yes. Social context. So basically, social anxiety disorder will be like central future. So agoraphobia, maybe social settings. So figure type could be like same thing. Specific phobia is a physical danger, and social anxiety disorder more into like a negative judgment, and agoraphobia is as discussed trapped and helpless. So apart from the major types of phobias we discussed, there are an unusual phobias, rare and unusual phobias. I think I mentioned in the previous slide where I mentioned about nomophobia that is prevalent nowadays, fear of being without a phone, and fear of bathing, fear of beards, fear of holes. There are quite a few different kind of unusual phobias. You can see the screen. There are several. We are not getting into detail in each one of those, but you can learn more those fears more extensively with the other additional information. So why does it matter? So why understanding phobia matters? So if you early onset, basically if you phobias often begin early and can persist into adulthood. So phobias frequently precede depression, substance use, or other anxiety disorders also. So globally and in India, most individuals go untreated due to stigma, awareness, or lack of access. As Vijayata mentioned in the previous slides, where a lot of these are basically untreated, mostly in India, because they have due to stigma or awareness issues or lack of access. And gender disparity, women are consistently at higher risk, these phobias. So,
All right.
yes.
Now, phobias or anxiety don't just cause fear at all times. They can also deeply disrupt our daily routines and the relationships that we share, leading to people avoiding us and we avoiding important activities like work, travel, social gatherings, etc. This avoidance often brings emotional distress and increases the risk of more serious challenges, such as depression and substance abuse. Now, we've understood a lot about phobias and fears, the difference between phobias and fears, and what are the different types of phobias, how they can be diagnosed, is something that we will look at now. Now, diagnosing phobias and anxiety disorders involves a very careful clinical evaluation. This is an included structured interview like the SCID-5 and specialized questionnaires that are designed to assess the severity and impact of the symptoms. There are several psychometric tools as well, like a few listed on the screen, that help professionals get a clear picture while ruling out any other medical cause that is leading to this particular symptoms. And that is the most essential part. While we talk about the diagnosis, it is also very important to remember that self-diagnosis at any given point of time should be avoided. Because self-diagnosis is based on any information that we may find either online or from non-professional advice and can be misleading. So always seek help from qualified professionals only. Now, talking about the treatment approaches. When it comes to treating phobias, several proven approaches can make a real difference. Cognitive behavioral therapy, CBT, being the gold standard, is often combined with an exposure therapy called as a systematic desensitization. Now, in the systematic desensitization therapy, a person is exposed to the phobia that they have gradually over a period of time so that they lose that fear or the phobia, that phobic symptoms that they have towards that particular object or situation. There is also group therapy that helps them, especially if the person is suffering from social phobia. And also, there are medications like SSRIs, beta blockers that are prescribed by the certified practitioners only. Alongside, there is talk therapy and mindfulness, and a few relaxation techniques that are prescribed to people who are suffering with this so that they can instantly relax in the panic-like situation that they have. Now, under the mindful and relaxation techniques, there is something called as a Stress Fit Wellbeing Toolkit 30. This is something which has 30 techniques in them, which help the person come out of the situation for the moment, apart from following the other prescribed treatment approaches. Now, I just like to mention here while we're talking about the Stress Fit Toolkit, that this is something that is available at Sudisha as well, where we help clients who come to us for treatment of phobias. Right? Over to you, Ram sir.
Yeah, as now we learned about so many different type of phobias and causes and criteria and everything. Now we should understand how do we cope ourselves, like coping and self-help strategies. So it's like building a fear hierarchy and by using a breathing techniques, like you general yourself triggers and figures what are the triggers it is causing, and gradual exposure, as Veda spoke about, desensitization, and joining different support groups for the phobias, and some grounding and visualization techniques. So basically, observe the picture, the different uh, rela- pictures are available there. If you see that the same thing conveys here. So when to seek help? Fear interferes with the daily life. When fear interferes with the daily life and avoidance limits relationships or a career, and panic attacks or physical distress, or sometimes it could be a depression, hopelessness, or isolation. Whenever you feel these kind of things, you try to seek help.
All right. So, like we said, that treatment, finding support and help is very important. Likewise, finding the right support is the key in dealing with any kind of these anxieties or phobia. Fortunately, there are many resources that are available online and otherwise as well. So, there are several helplines that you can dial in and reach out for help in case you do not have the feasibility to walk into a particular setup directly. There are also a few trusted websites for help and apps that you could use to calm yourself down. Then, apart from this, there are also local therapists that you could look at. Please keep it, in case you're suffering with any kind of phobia, we'd suggest you keep a list of local therapists handy so that you can connect with those professionals or any kind of organizations that can support you. Additionally, for those who prefer to read things about self-help, there are certain books that are available. A few are mentioned on the screen, but there are a lot more that you can find and pick what you would like to read. With that, we come to the end of the discussion about phobias and all the things are related to phobias about treatments, etc. Now, one thing that we would like to talk about here is coping statements. For the ones that have been attending the sessions in the last 4 days, you've understood what are coping statements. However, let me just give you a quick clarity about that. Coping statements are a very powerful tool that help us manage things on our own. They can help us manage intense fear and anxiety that come along with phobias in this situation. Now, these simple and reassuring phrases remind us that we are safe, capable, and making progress, even when the feelings feel overwhelming. Using these statements can help us calm our minds, build confidence, and support us in facing any kind of challenging situation one step at a time. Now, you'll see a lot of coping statements on the screen. However, I would like the audience to share any of the coping statements that they can think of for phobias in the chat box. Some of the coping statements that are there is, I'm making progress. I'm willing to try. All right, this will pass sooner. Great. Relax, breathe in and breathe out. All right. Thoughts are not facts. Yes. There is always a bright side. Absolutely. I am stronger than my phobias. Yes. This situation is going to get away. Absolutely. My resilience check. Okay. Wonderful. I think we've got quite a lot of coping statements and you all are doing a great job with that. So now moving on to the next part. Before we move ahead, we'd like to thank you for being a part of today's session. Please remember that seeking help is a sign of strength and support is always available when you need it. Additionally, for any other kind of follow-up or guidance, we'd suggest that you feel free to reach out to Sudisha Counseling Center at Kundapur, and the contact details are available on your screen. The dedicated team here is always ready to assist you on your journey for better mental health. With that, I will just give you about a minute to take a screenshot of the screen for the details in case you would like to save it. Now moving over, I think we've covered a lot today, and now it's your turn. There is a space that you can ask questions, share your thoughts, or even just reflect on what stood out to you. Whether you're curious about something or there is a personal insight, please feel free to share your thoughts. Or even if there is a question, be it the simplest or the smallest question that you might think, please remember this is a judgment-free zone. And now the floor is open for Q&A. I would invite Geetha ma'am to go ahead and answer the questions as and when they appear on the chat.
Right. Yeah, I'm here. Good evening, all of you, and congratulations with Vijayta and Ram.
Thank you, ma'am.
Good job, well done, and feeling happy and proud again every day evening to see my students performing on the screen, conducting a webinar independently. It's a real moment for a teacher to feel proud of self. So good job, well done. And any questions? They already covered many things, and it was, properly explained everything. But still, if you have anything to ask or anything to reflect on the workshop, so it's not about questions. It can be about your reflections on the workshop. We welcome you.
There's
There's
one
a-
question came up.
Yeah.
Is that
Chappan.
phobia leads to hallucinations?
No, there is no direct connection. It's not phobias is leading to hallucination. Phobias, comorbidity, having, getting into another disorder. But phobias, we do not have hallucinations, whatever knowledge I have.
Thank you,
It's a
ma'am.
different-
Namaste, Madam Geetha, Madam.
Namaskar.
Madam Ramalakshmi.
Chappandi,
After a long
Chappandi.
time again.
Yes, ma'am.
ఏం లేదు మేడం. Is it a part of the obsessive compulsive disorder, this phobias?
No, obsessive compulsive disorder is different. Phobias are different. In obsessive compulsive problem, we have recurrent negative thoughts, false thoughts, which are called obsessions. And because of those obsessions, we means the person will get into the that anxiety mode, and then to subside that anxiety, they will dwell into the compulsions. Compulsions are repeated actions. So that is entirely different from
Okay.
phobia.
Ma'am.
Okay.
Geetha,
Okay,
ma'am.
Thank you, madam.
Yes, sir. Chappandi.
Does it have any genetic rootings for this, ma'am, phobias, or is that they are developed over a period of time?
I think they covered in the root causes. Yes, Vijeta and Ram?
Yes,
Genetic,
ma'am.
yes, genetic is also.
They do
Yes,
have a
yes.
genetic predisposition.
They do have. They do have.
Yes.
Sorry, I think
Most of the mental health issues have a, roots in the genes also.
Yes.
That's why
Oh,
in the counseling session, in the first session, what we do is in the intake session, if you see, we ask a question. Do you have any
yes.
mental health history in the family? Do you have anybody using medication?
Yes, I know.
So this is the question where we find out the
Yeah.
history. Yeah. I think you also,
Thank you.
in internship, I think you understood this.
Yes, yes. No, I still wanted to reconfirm once more.
Mhm.
That's it.
Right. No problem.
Thank you, ma'am.
Okay. Any other questions or comments? And every day it is very interesting that every day we are talking about one disorder by, dynamic, different counselors, and real psychopathology is seen on the screen every day. And they are really doing wonderful job they are doing. And this is English series going on now. And very shortly, once we are done with the English series of workshops, webinars, we'll be starting the Telugu versions of it. So you have a different set of counselors who will speak in Telugu about the entire PowerPoint presentation, the same thing, and maybe added more.
Ma'am, I think somebody
So
has a
glad, madam.
question.
This is a
Satya,
great
sir.
initiative. I think very useful to all of us. So
Yes.
thank you very much. That's a
Yeah,
great.
I wish all the students of psychology who may be in intermediate or who may be in graduation, post-graduation, MPhil or PhD, all of them should watch this, because we read. See, if you can take, DSM-5 and start reading, or you have many books, but still listening from them, because the speakers have referred, I think, over up to 100 different sites and different blogs, different books, and they spoke to people. So this will help us to get more resources in one go, and listening to someone is actually more insightful compared to reading. For me,
Yes,
if I
certainly.
listen, I learn more. So I
Certainly.
want, I wish all the students of psychology, get benefit out of these webinars. And we are having these webinars in the YouTube. So it's not for a day. Always you can visit them back. It's not one-time affair. If you listen one time, that is good. You understand. But then next time, after 1 week, you have a question again. So these webinars should be listened again and again. Psychology, if you're a student, if you're a counselor, if you're practicing anywhere, please listen to them again and again.
So they are in on
Every time.
YouTube.
Yes. They are in the YouTube.
There is one more question, ma'am. Phobias happen right from birth, or do they develop after some time, or both can happen?
Both can happen. Birth mein though, I don't think it is like from the childhood it is there, but birth means the children doesn't know what is fear, what is phobia. But I have seen a child with who was 4 years old with phobia. So it can start at any age, and it is not that it will continue for lifelong. Phobias can be worked on. You can come out of phobias. It's not tough. It is possible. It's not impossible. It's possible to work on your phobias, and you can lead a healthy and happy life. Yeah.
There's one more question, ma'am, which says, out of the fear and phobia,
Mhm.
do people grumble in their sleep? Like a kind of fearful weeping or something like that in their sleep?
हो सकता है, हो सकता है, हो सकता है. But it is not compulsory that everyone having phobia will do it in the sleep. No, some of them do because of anxiety or phobia. As I mentioned, the child whom I saw, the 4 years child, she had claustrophobia.
Oh, okay.
Claustrophobia. She was not coming into my room also. She was sitting, outside my cabin. There was a tree, so under tree she was sitting, and she don't want to come inside because I locked the door. So then what I did, I went out. I sat near the child under the tree for a few sessions, and then tried, building rapport and everything. After 2-3 sessions, she just entered my clinic. But she's out of it.
I think somebody, Satya Jangam, I think he had a question. You'd like to unmute and ask that question, sir?
Yes, please. Or you can chat. You can send your question in the chat box. So irrational fears, and this phobia is nothing but it's an irrational fear. Because there was a rare case which I saw. The student, she was an engineering student who had fear of red color flowers. Phobia for flowers. Hibiscus flowers, mandara ఉంటాయి, అవి చాలా భయం ఆ పిల్లకి. So where from it came, why, that specific phobia, we don't know. But she was avoiding walking in the garden. The entire rasta ko chhod ke jati thi wo, because red flowers are there. So very typical. Phobias sometimes are very typical. And we should be very empathetic when someone come and say, నాకు భయం వేస్తుంది, or if they express about their phobias, you should be very empathetic and just listen to them. Because अरे अदेंटी భయం, why so much of fear, it is simple, no? ऐसा नहीं बोल सकते. As a counselor, you should be very empathetic, non-judgmental. Just be with them, help them to come out.
I
Right.
think no
Okay.
more questions, ma'am.
Right.
So that's
Your
pretty much
webinar
what we
was so
had.
clear, so no questions for
Thank you,
my
ma'am.
students.
Okay, there's one
Yeah.
last question I think that came up just now. Can one be without any reason, or I think they're asking, can phobia be without any reason or due to any trauma?
हो सकता है. Yeah. As I said, it is not compulsory. It's not definite that they should have a root cause or a trauma or a triggering event. Suddenly, some phobias develop without any reason.
I think the case that you just mentioned about the hibiscus flowers, that speaks about it.
Yes,
There was no
absolutely.
such reason that we could pinpoint on that.
We tried a lot to find out, but I didn't find any reason. But I could help her with through the exposure and response prevention. She was helped, and she's fine.
Ma'am, can I ask one more question?
Yes.
Good evening, ma'am. It's a wonderful session, ma'am. I'm still one more question. One of my known person, she is very much afraid of staying alone at home. At home, she cannot sleep alone. Also, she needs someone beside her. On the bed, also, she'll not sleep alone. She needs someone or other beside her. She has two sons. One son is settled in abroad, and one son is staying with her.
Okay.
So, is there any such kind of a phobia or fear? What we happened to ask her, what is the cause? She told, no, I cannot stay alone. I'm afraid. Something like that.
See, is it fear or phobia? Is a different thing, but then it can be worked on. You can work
But
with.
while going to the washroom, also she wants someone to stand outside that she should not fall down. She's not 70, but she's just 67, 68 years old.
Yeah, so we need little more case history to understand whether it is fear, phobia, or loneliness, or she's missing the, family members, or insecurity. There could be multiple reasons for this, what you are mentioning. So we need to have a 45 minutes of intake session to understand more.
Okay, ma'am. Thank you so much.
Thank you.
I think apart from these, ma'am, questions are done, but the people sending in their appreciation for the session and the series of wonderful sessions that we're doing.
So thank you so much, and I appreciate Ram and Vijayta again once more.
Thank
And
you.
looking forward to see you for one more dynamic and vibrant session tomorrow evening. So thank you all for joining, and I want you to spread this word to others so that they will also join and get help about it. Okay, over to Ram and Vijayta.
Thank you, ma'am. Thank you everyone for being with us today. And we look forward to have you join us again tomorrow for another wonderful presentation on schizophrenia. And wishing each one of you a pleasant evening. Have a good, restful day.
Thank you, ma'am.
Thank you.